Hello, everyone. This is Nicolas Chateau at Imaginize. Thank you very much for joining this webinar on microvascular imaging in the retina with adaptive optics cameras. Initially, we introduced this technology for imaging photoreceptors, and for us, it was a surprise when several clinical teams started using the same device for exploring retinal blood vessels. But now, so far, their work has resulted in 44 publications. And today, in this webinar, we propose to focus not on science, but on personal insight with 3 clinical users of AO cameras who very kindly agreed to share their experience and vision. This will be a 30-minute discussion, including time for interaction with the audience in the second part of the session. So please type any question or comment that you may have in the Q&A. And now Marine is going to introduce our guests.
For the roundtable discussion today, we are pleased to welcome Michel Paques, Professor of Ophthalmology at the Castro-Farias National Eye Hospital in Paris. He is a pioneer in the development and use of adaptive optics retinal imaging in a wide number of diseases. Hello, Michel.
Hi, thank you for the invitation.
We also have with us today Daniela Castro-Farias. She is also an ophthalmologist and she works in Professor Paques' team. In her research, she used adaptive optics imaging for studying retinal function. Welcome, Daniela.
Thank you. Hello to everyone.
And our third guest is Antonio Gallo. He is a doctor in internal medicine at Pitié-Salpêtrière Hospital in Paris. His research focuses on microcirculation and on the prevention of cardiovascular events. Hello, Antonio.
Thank you, Marine. Hi, everybody.
So to start this roundtable discussion today, I want to ask to our guests about your motivations for using adaptive optics. So Michel, how did it all start? What drove you to start looking at vascular diseases with adaptive optics?
Well, I've been using, it was about 10 years ago, I was using for a couple of years the first version of the RTX1 machine, and for studying, as Nicolas Chateau said, mostly photoreceptors. And so we gained quite a lot of experience, but we were always puzzled by the presence of these shadows of vessel everywhere, but we did not pay much attention until there was a new version of the camera that went out, and we just incidentally, but just by changing the focus of the camera, suddenly vessels were visible, but something entirely new was visible. That is the vessel wall itself, which was completely unexpected, because you have to know that when you look at color fundus photograph of vessels, you barely see only the red cell. You see the red stripes, which are, let's say, pinkish for arteries and more dark for veins, but that's all you can see of vessels using conventional imaging. And this offered a whole new world of looking directly at the structure of the vessel itself, and especially measuring. So we have quantitative approach of microvessel. That was quite fascinating, I have to say.
I see. So it was really a surprise that you did not expect to be able to see such details with the adaptive optics. So now, Antonio, as an internal doctor, what is your motivation for studying the retinal vessels using adaptive optics?
Well, Michel came to tell us the story, so he contacted us, and we were very happy as a cardiovascular prevention technique was available, was capable of doing, mostly in our primary prevention subjects treated for arterial hypertension or type 2 diabetes with no microvascular complications. So we were quite interested in seeing if with this near histological level of detail in the morphological exam, we could detect some very early changes that take place in these cardiometabolic diseases, so namely hypertension and diabetes. So with some friends that are among the audience, we started to look and recruit quite by the possibility to explore completely in a non-invasive way in vivo what was happening in.
Okay, and I understand that it was really a new tool that you are excited to start using in your research. And now I want to ask Daniela, what is your interest in this type of imaging? What do you wish to contribute with adaptive optics?
Well, I think it's like the last step. It started with photoreceptors and the study of vessels, and now my research has to do with the function, like in the moment function of the retina. So I'm studying neurovascular coupling currently in healthy patients, and this is like a technique that has already been studied and described, but with other imaging methods. So it's mainly with MRI. And my interest in adaptive optics is being able to do that same exam, but with a more detailed function. And this was a collaboration that was proposed to me when I was doing my master's in science.
Thank you to the three of you for sharing these exciting perspectives. So now let's talk about your findings and the methods that you designed to obtain them. Antonio, can you give us an example and how you did it with adaptive optics?
So this is the first images that we were able to acquire. So with a 5 to 10 minutes acquisition, with the patient just being asked to stand still and possibly wink during the acquisition, we were able to capture images on a sufficiently long segment on the upper temporal arterial and venule, and we were able to detect the vessel diameter and mostly the arterial wall. The acquisitions were quite easy to do, and the analysis was semi-automatically performed by the software, the AO Detect software. So we could measure actually the internal and external diameter, the parietal thickness at the arterial level, the diameters at the venular level, and so we could calculate the wall to lumen ratio, the wall cross-sectional area, and the arteriovenous ratio, meaning the ratio between the arterial and venular diameters. We were also interested in the variability of the internal diameter, and that's something I might probably talk after. What we saw in the cohort of hypertensive patients, for which we had both office and home blood pressure levels, was that subjects with an uncontrolled blood pressure had a significantly higher wall to lumen ratio. And this was associated with an increased wall thickness, whereas subjects with a masked hypertension, meaning who had normal blood pressure levels in the office, but increased blood pressure levels at home, had a very tightened arteries, meaning a very small lumen diameter. So we were quite intrigued by this, and we tried to treat these subjects with a masked hypertension, and we observed that these changes were actually reversible. So that having in, let's say, normotensive subjects according to office blood pressure levels, having them treated when they had a very small artery, because this was a sign of masked hypertension, helped us find a possibility to treat a very early change at the arterial level.
Thank you very much, Antonio, for these explanations about what you observed in hypertensive patients via their retina. And now I want to ask Daniela, how did you use AO imaging to explore retinal function, as you said earlier?
With the possibility of studying the arteries and the veins, and with the detail of the walls. So then we thought that we could study the neurovascular coupling. So this is, for the persons who don't know about it, is just the response of the vessels to stimuli, and in this case it's light. So usually, since it's a nervous tissue, it is going to increase the metabolic functions due to the increase of the stimulus. So we thought that with the integrated light of flicker light in the RTX1 camera, we could stimulate the retina and see the difference between the basal images and the images under stimulation. So we developed a protocol where we took 3 basal images and then 3 images under stimulation. This is a series that we were doing for every single patient. And then we measured, as you can see in the second image, the inner diameter of the arteries. So in the 6 images, we did the same thing. And then we compared the inner diameter of the images under the flicker light to the basal images. And there's a percentage of dilation, which we studied. And we could see that it is the same as the results obtained with the other methods that study the neurovascular coupling, with the advantage that it's a non-invasive study, that it's that you can just see the retina with a dilation of the eyes, and it's in, let's say, kind of quick. So it takes 3 minutes more or less to study one patient. So I think that just proving that we can obtain the same results as with other images, it's like the basis and the start to develop other results.
Thank you very much, Daniela, for this example of how, just as you said, the start of studying the retinal function at such a microscopic scale, I would say. And Michel, would you like to share another example of results?
Yes, I've been interested in all disease that can affect vessels in ophthalmology. I mean, from perspective of the ophthalmologist, and but not only on hypertension. I'll show you here 2 examples of what can be interesting to it's important to, these findings are quite important because it may expand the phenotype of disease and have a more accurate diagnosis and more precise and eventually quantitative approach of some diseases that are difficult to characterize. The first example is inflammation. There's an example of what we call vasculitis, inflammation of a vein wall. And there you see along all this nice montage of adaptive optics images, you see you can point the vein. And if you look carefully on each side of the vein, which is quite irregular, you see some slight opacification in the middle, close to the middle of the image. You see one of these examples along the vein. Yeah, there it is. So these are examples of inflammatory infiltrates surrounding the veins, which are characteristic of vasculitis that may occur in many diseases, it can be multiple sclerosis, for instance. So, and this is totally undetectable by conventional means. You take phonograph, you take OCT, you don't detect it. You only detect it by adaptive optics ophthalmoscopy. And so and this is despite the fact that it's quite extensive, it escapes conventional imaging. So this enabled the specialist of inflammation of the eye to expand their knowledge about what occurred in the eye during various diseases. And this can be provide also some important biomarkers for studying the effect of therapy, for instance. There are many therapies of multiple sclerosis currently. And this can help to not only detect the eligible patients, but also follow the effect of treatment, because this is reversible. But that's the first example. The second example is related to hypertension and aging and hypertension, because we see more or less the same thing in aging and hypertension. And on the animation, what you see is an artery and a vein, and notice the change in diameter of artery. This is spontaneous change, not as Daniela just showed under flicker stimulation, but this is change that observed over months or years in patient with severe hypertension. And I think it's a patient age 70 years or more or less, and has also kidney disease. So in this case, we see, as we expect, some irregular arteries. But the surprise was to find that if you follow these patients, quite often you can see reversal of these irregularities of arteries. And this led us to the hypothesis that the irregular constriction of arteries may be not degenerative, but an active process of vasoconstriction, which may be reversible even after years and years of the presence of these focal arterial narrowing. So this also enables us to think of other concept of vessel aging more than degeneration and thickening of the wall. Indeed, it may just be chronic vasoconstriction, so amenable to treatment potentially. And this is very interesting if you're interested in what happened in the brain, in fact.
Well, thank you very much for these impressive examples. And we know that you have published a lot more, the three of you. So now I want to ask you about your vision for the future of this technology. Daniela, where do you see the most interesting applications for adaptive optics, retinal imaging?
Well, as I was saying at the end of the previous question, I think that this is just the start of being able to study, because until now we've done it only with healthy subjects and some neurological diseases, but we can explore anything that has to do with a problem in vessels, in neurological diseases, or even in diseases that include the glia. So this is like the neuronal triad, and it's the function. So this means, for example, being able to study patients with glaucoma, with diabetes, with Alzheimer, maybe, like everything that touches vessels or the brain. Also, for example, it would be interesting to see what happens in hypertensive patients. And since it's a non-invasive method, I think it's quite easy to obtain the results and maybe predict or do the correlation with the general status of health of a person. Like really just going to the ophthalmologist and performing an exam like this could be the reflect of what's happening in a minor scale in all the body. So I think it's just like a window for health problems.
And Michel, where do you see the value of AO imaging?
The future of this type of imaging is quite open. I mean, morphometry of retinal vessels is a whole new field, and Antonio and Daniela have shown that it actually helps to understand many aspects of clinics that were previously overseen. And that I feel another example or another illustration of the interest also is to have an extensive approach of, let's say, a global approach of the state of the vasculature in general. And for this, we will need some softwares for extensive characterization not only over a single point of the vessel, but also over the whole vasculature, and to imagine novel biomarker reflecting the general aspect of the retinal vessels. And because we can imagine again that it helps to understand the status of the brain. So Daniela mentioned Alzheimer. That's a very good point, because Alzheimer is also related to the status of microcirculation. So there's currently extensive work going on to extract the most meaningful biomarkers from this approach. And also coupling to function, I think, will be very important, not only vascular function, but also retinal function, because we can do flicker stimulation can also be used to characterize the response of photoreceptors. So we're going back to photoreceptors, but that's another point where it's not related to vessel directly.
And Antonio, what about internal medicine? how do you think AO imaging can be most useful in this field?
Well, following what Michel said, I think that the follow-up of patients that have been already characterized at diagnosis, the response to treatment might be a key feature for the adaptive optics examinations. For example, in resistant hypertensive subjects, we could observe a short-term actually change in a wall in the microvascular structure after treatment, and also we observed that in subjects who presented some of the features that Michel showed in a definitely much more detailed image with a microconstriction, with segmental microconstrictions, we could actually observe a normalization of the vascular caliber after normalization of the blood pressure control. So I really think that in hypertensive subjects with an uncontrolled blood pressure, following up at the retinal microvessels levels, the state of the vascular morphology could help in actually depicting the response to treatment. And also in uncomplicated diabetes, I think that for what we have also explored in previous studies, I think that it could also be very useful for the detection of subjects that are more at risk than others. So it could help actually stratify probably the cardiovascular risk lie behind the state of diabetes.
Well, thank you very much, Antonio, Daniela, and Michel, for sharing with us your personal experience and your vision today. Sure, it has inspired questions from the audience. So it is now time for the Q&A.
Question from Martin Hammer for Daniela, I think. What does your video show? So there was a video in your slide showing a vessel dilating. Is it pulsation or dilation on a longer time scale?
It's a time lapse. So it's a video of the 6 images in a row. So 3 basal images and then the 3 images under flicker stimulation. So you see the dilation after or during stimulation. So that's what it was showing.
Okay, so it is the dilation induced by the stimulation with flickering light, right?
Yeah.
And there is another related question from Arin Famrong. When you mentioned neovascular coupling, do you mean neovascularization with diabetic retinopathy or AMD? So maybe Daniela, it's good to explain.
So this was done in healthy subjects, only healthy subjects, and the neurovascular coupling is the response of the blood vessels to stimulus of light. So it's you send a stimulation to the neurons, in this case of the retinal neurons, with light, and it's the vessels who are going to respond with dilation. So that's the neurovascular coupling, but it's not in diseased patients.
And a related question from Damiano Rizzoni. In your opinion, Daniela, to which extent flicker light response is due to a neurovascular reflex or maybe regarded as an endothelium-mediated dilation?
So that's why we compared the 3 basal images between them and then the images under flicker stimulation to be sure that there was like no bias. And we found that the basal images differed less than 1% between them, and the flicker, the dilation was 3%. So those are the comparisons between the images between under stimulation and the basal images. So let's say 2% if we do the maths, like more or less between 2 and 3% of basal versus the, stimulation.
If I may complete the answer, it's also, we did not distinguish endothelial derived dilation. We could use some tests such as trinitrin induced vasodilation, but we did not go further on to understand which part is involved in deficit, because we also study disease patients. But that could be theoretically done. Yeah.
Thank you, Michel. A question for Antonio. Would you say the device is easy enough for a non-ophthalmologist doctor to use in day-to-day practice?
I think that globally, yes. Of course, it's a training is needed, and with the practice, the time of acquisition might get shorter and shorter. But globally, I think that it's definitely easy to use device.
Thank you. There is a question from Rupesh Singh to Michel. The presence of inflammatory cells around the vein, was it verified by histology or any other mean?
Yeah, very good question. Indeed, not in this patient, that's in vivo observation, of course, but we've been conducting research on inflammation in multiple sclerosis, otherwise by using other techniques and confirming that there are indeed cells that, because we see some rounded structures, the size of what has been seen experimentally, and also moving over time. So we're quite convinced that what we can detect cellular inflammation by various means, either RTX1 camera, but also AOSLO. So what we observe, we believe that it really is inflammation, and it's also can be it disappears over time when inflammation resolves. So we're quite confident it is inflammation.
Thank you. Now from Bukartik, we have, could you provide information on the software validation for the wall and lumen measurements, including also intra and inter observer variability? Antonio, do you have some numbers in mind?
Yes, we did this, and actually the concordance was very high with the intra variability, with the intra individual 10% concordance rate, and it was below 10% in the inter individual study. So it was validated because according to other methods, it was much better performing than, for example, other devices.
And now, so another question is, how well is hypertension detected in terms of probability?
Yeah, we tried to check this also on a cohort of 1,500 subjects, and we had, because we were trying to find actually a cutoff of lumen diameter. Wall to lumen ratio that could explain the presence or absence of hypertension, and we got an accuracy of about 70%, only considering the wall to lumen ratio. We later found that the information on the wall and the lumen separately, or some other parameters like the lumen variability, could add some further precision, and so could improve this detection probability.
Okay, the next question probably is for Daniela, because you mentioned a 3-minute procedure, and the question is the measurement completely automatic within the 3 minutes of examination, or if not, what is the human impact factor that might alter the results?
No, it's not automatic, but it's very easy. So you just need to push buttons. So the first we do the 3 basal images, and you just need to acquire the image by pressing a button. So that takes more or less 2 seconds per image. And then the acquisition under flicker stimulation, also you just push a button and the stimulation starts. It's an integrated light of the RTX1 camera. It's a yellow light. And then the acquisition, the image acquisition is going to be during the 2 last seconds of the duration of the stimulation. And so that is automatic. And you just need to be sure that the patient doesn't move, and that's it. Of course, if the patient has troubles with blinking or staying still, well, it's gonna impact the quality. But if not, it's pretty easy.
Okay, thank you, Daniela. Unfortunately, I see it's already time to wrap up. Now, before everyone disconnects, I want to say many thanks to our guests, and thank you all for your participation in this webinar. I hope you liked it. Thank you and goodbye.